Hi, it's Tara Scott from Revitalize. So today I want to talk a little bit about types of testing for hormones because there are a lot of different opinions and there's a lot of confusions because some patients come in and they say my doctor only did blood tests, and some patients come in and say my doctor only did saliva tests. So I wanted to kind of go through the different types of testing and why we do what we do. At Revitalize, we do all types of testing. We do blood testing, traditional testing, saliva testing, we do urine testing, and we do something called blood spot testing, which is when you prick your finger. So how do you know what you need? Well, all of them measure different types of things, so it depends on what we're trying to figure out. So for example, if I'm a census taker and I want to come to your home and count to see how many people live there, if I come in and I see you and your husband sitting there in the kitchen, I say there's 2 people that live here. But I don't know that you've got 2 kids upstairs in the bedroom and 1 away at college. So I really haven't accurately assessed the population. I'm not looking in the right place. I'm looking only in the kitchen where there's people in the bedroom. So that's like blood is only one compartment. Blood is the highway. Blood carries things from one place to another, but that's not where your hormones work. So certain hormones are good to measure in the blood, like the brain hormones, like your TSH or your FSH, because we want to know what's going on, and we obviously can't reach your brain, so we got to see what the hormone levels are in your blood. As well, we can measure your sodium and your potassium and your copper levels and your zinc levels. We can also measure your cholesterol and your sugar in your blood. Now, if we wanted to look at the nutrients, we'd have to look at what's inside the cell, not outside of the cell. When you draw blood testing, the first thing they do is spin off the red blood cells and throw them out. So that's another reason why blood testing can often be inaccurate for hormone levels, because if you have ovaries and you're making hormones, then those hormones are going into the blood. But if you're someone who's had a hysterectomy and you don't have ovaries, you're not going to be able to accurately see what your body's making because your hormones are coming from your adrenal gland. They're being converted in your muscle and fat to a different type of hormone, and that's where your body is getting it. So by checking the blood, I'm going to miss it. That'd be like saying my 16-year-old daughter is leaving my house every morning in sweats, so she must be a good kid. But as soon as she gets to high school, she's putting on a tank top and a miniskirt. I'm not seeing her change her clothes when she left the house. Certain hormones change into other things in your cells, so by doing blood tests, we're going to miss that conversion. So that's why a lot of times we like to do saliva testing. Saliva testing is best to look at your cortisol levels and to look if you're using a topical hormone for women. The other type of testing we do is urine testing. So urine testing would be if we wanted to see what your body did to the hormone and how your body used it. So a lot of times we like to look at the urine metabolites. Think of it as if I'm a tax accountant. I'm looking at all your receipts. I don't need to watch you buying things or watch you purchasing, making purchase or paying your bills. I just need to see the receipts so I can make some kind of meaningful evaluation. So a urine test is looking at what's leaving your body so I can extrapolate how is your body metabolizing hormones. Are you stockpiling them? And if I wanted to look at your blood spot testing, I'd prick your finger. I'm going to see what's in your tissue right now. That's whole blood. So that's accurate for a diabetic to measure his glucose. That's also an accurate way to look at some hormone levels as well, as long as you're using some topical hormones. So there's a lot of debates even among doctors as to what types of testing is the right way to test, but I would say we do all of it. We personalize it to make sure we're getting the right testing that you need. So if you're someone who's interested in hormones or taking hormone therapy, make sure that your doctor is checking the right kind of testing for what you're taking.